hygiene is the cleansing of the hands with the help of sanitizer or with the help of soap and water. Hands are the number one transmitter of healthcare-acquired infection, and effective hand hygiene is the best way to prevent infection from spreading to one hand to another. Hand hygiene techniques are of two types: hand rub and hand wash. Now I'll explain you how to hand rub. Step 1. Apply sanitizer full of hands. Step 2. Rub hands palm to palm. Step 3. Right palm over left dorsum with interlaced fingers and vice versa. Step 4. Palm to palm with fingers interlaced. Step 5. Back of fingers to opposing palms with fingers interlocked. Step 6. Rotational rubbing of left thumb clasped in right palm and vice versa. Step 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Step 8. Once your hands are dry, you are safe to use. Next I'll explain you how to do hand wash. Wet hands with water. Step 1. Apply enough soap to cover all hand surfaces. Step 2. Rub hands palm to palm. Step 3. Right palm over left dorsum with interlaced fingers and vice versa. Step 4. Palm to palm with fingers interlaced. Step 5. Backs of fingers to opposing palms with fingers interlocked. Step 6. Rotational rubbing of left thumb clasped in right palm and vice versa. Step 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Step 8. Rinse hands with water. Step 9. Dry hands thoroughly with a single-use towel. Step 10. Use towel to turn off faucet. Step 11. Your hands are now safe to use. Indications for your hand hygiene. Moment 1. Before touching a patient. Clean your hands before touching a patient when approaching him or her to protect the patient against harmful germs carried on your hands. Moment 2. Before clean or aesthetic procedure. Clean your hands immediately before performing a clean or aesthetic procedure to protect the patient against harmful germs, including the patient's own, from entering his or her body. Moment 3. After body fluid exposure risk. Clean your hands immediately after an exposure risk to body fluids. Protect yourself and the healthcare environment from harmful patient germs. Moment 4. After touching a patient. Clean your hands after touching a patient and her or his immediate surroundings when leaving the patient's side to protect yourself and the healthcare environment from harmful patient germs. Moment 5. After touching patient surroundings. Clean your hands after touching any object or furniture in the patient's immediate surroundings when leaving, even if the patient has not been touched, to protect yourself and the healthcare environment from harmful patient germs. Few other advices. Wash your hands when they are dirty, before eating and after toilet. Do not cough into your hands. Do not sneeze into your hands. Do not put your fingers into eyes, nose and mouth. Stay indoor if you are sick. Get vaccinated. Avoid contact with your co-workers and others who may have flu. Let's work together to prevent the spread of infection. You take a pledge, we'll treat you well.